All right, everyone, we would like to welcome you to tonight's presentation. My name is Shayna Overfelt. I'm the moderator. I am also the Director of School Programs for the CDCA. This evening, we are excited to present the 2021 Dental Hygiene, the ADEX Dental Hygiene Examination. This presentation will solely focus on dental hygiene. We know this was one of our most requested presentations, so we're very glad you all are here. So to begin, I would like to start with just some quick, while we all know how to use Zoom these days, we quickly just kind of give some reminders. The first thing to talk about is muting. You all, as you come into this call, are muted for this evening's presentation. If for some reason you become unmuted, you may mute yourself and know that you're muted by seeing the red line through the microphone button on your screen. In addition, really, the purpose of this meeting is to have you all participate with us, ask your questions, let us answer those questions that you have. And so what we've created is a Q&A where you can ask those questions. I, as the moderator, will present those questions to one of our panelists here with us tonight. And last, well, you know what? I got rid of the slide about participation because we just want you to participate through the Q&A. So to begin, I would like to introduce Dr. Mark Armstrong. He is a graduate of Case Western Reserve University School of Dental Medicine. Dr. Armstrong has been in private practice since 1989. He received his gubernatorial appointment to the Ohio State Dental Board, where he served as vice president in 2007, 2008, and president in 2009. Next, I would like to introduce you to my dear friend, Pat Connolly Atkins. She is the senior advisor to the CDCA and has an integral role in the development and delivery of both the patient-based and mannequin-based dental exams and the CSCE OSCE. She has previously served on the CDCA Board of Directors. She has served as the ADEX Dental Hygiene Examination Chair Committee, or on that committee, and on the ADEX Board of Directors. Currently, she is district number 10, district hygiene or dental hygiene representative to the ADEX examination. Ms. Connolly Atkins, which is funny for me to say that, Ms. Connolly Atkins is a former dean of Forsyth School of Dental Hygienists and a former member of the Massachusetts Board of Dental Examiners. And then we have Dr. Stuart Blumenthal. He is a graduate of the University of Maryland School of Dentistry, where he also received his postgraduate education. In his role as Assistant Director of Examinations for the CDCA, he's been an integral part of the development and administration of the CSCE OSCE, patient and mannequin-based dental hygiene examinations. Prior to his retirement from private practice, Dr. Blumenthal was a pediatric dentist for over 30 years. So I would like to welcome you all to our panel. Thank you for participating this evening. Wow, you're a talkative group tonight. Okay, let's begin. Dr. Armstrong, I'd like to start with you. This is our acceptance map. I would love for you to take a minute. Please introduce yourself as well and tell us about this map.
Thank you, Shayna. I am currently the vice chair of the CDCA and am in the midst of my first term, just finishing up 2 years. I've also served on the board of directors as treasurer and a member at large. Currently, for dental hygiene, there are 45 states that accept the ADEX exam. 31 of these states currently accept the ADEX mannequin-based exam, at least on a temporary basis through 2020. 14 states have already committed to accepting the mannequin-based dental hygiene exam beyond 2020. We update this map almost daily, and that map can be found at cdcaexams.org. I do also want to note that while we are the largest testing agency that administers the ADEX dental hygiene exam, CETA also administers that exam, the ADEX exam.
Thank you. And just for tonight's call, we would like to note that the numbers you're hearing, the statistics we're hearing, the things that have gone on have come from the CDCA. So this is a CDCA-based presentation on the ADEX dental hygiene examination. Thank you, Dr. Armstrong, for that. I'd like to quickly, which I felt like we've already thrown a few of these acronyms out, I'd like to quickly cover what these acronyms are. We say them so readily, but just to bring everybody up to speed, the The CDCA is obviously our organization, the Commission on Dental Competency Assessments. ADEX, that's the exam that the CDCA administers. That's the American Board of Dental Examiners. PTCE, that is our Patient Treatment Clinical Exam. So prior to 2020, this was the exam that all candidates were taking as part of their ADEX examination process. This year, the MTCE made its debut. That is the Mannequin Treatment Clinical Exam. And last but not least is the CSCE OSCE. That is our Computer Simulated Clinical Exam. That is, you will hear us refer to that as the CSCE or as the OSCE. OSCE, of course, stands for Objective Structured Clinical Exam. So those are the acronyms you might hear us talk about this evening. I hope this kind of gives you a better map and you're not wondering, what did she just say? We love some acronyms over here. So next we will move on. I would like to quickly cover or ask Pat to quickly cover what our topics are tonight. We have got a lot of things we want to cover with you. We plan to get this done in about an hour. We appreciate your time, but also value it and know that spending the evening with us for an hour is very appreciative from our perspective, and we want to respect that of your time. Pat, can you please cover what we have going on this evening?
Sure, I'd love to. Thanks, Shana. And I too, I just want to do a quick welcome and thank you to everybody who's on this call tonight. We've found that these have been so informative for the listeners and for us too. So thank you. We're glad that you're here, and we hope all of your questions are answered by the time this hour is up. What we hope to do is, first, we're going to start off and just going over the 2020 exam, the dental hygiene exam, both the patient and mannequin. We offered both this year. We're going to talk about the OSCE, the CSCE, or some people call it the computer exam. We can even add that to it. So we're going to go over that. We want to cover the enhancements that are planned for that mannequin exam for 2021. Our performance data, I'm sure people want to know, how did everybody do? How many took it? All of that information, we want to share that with you. And then we want to give you some feedback that we've received and also get some of your feedback about the exam. So that's our plan for this evening. We will, of course, take questions that are outside of this. If we haven't covered something that is a burning question for you, please use the Q&A and please do ask it so we can be sure to cover it. All right, we're ready to go.
So Dr. Armstrong already covered.
Just a second. Dr. Blumenthal, Steph, can you go back one slide? Just there we go. Pat, if you could cover these quick topics for me, I'd appreciate it.
Okay, so this these three examinations right here, they're out, are the three examinations, the three ADEX examinations, the three examinations that CDCA offers to all of the state boards. And here you see all of the alphabet soup, you see everything all together. So we have that ADEX patient exam, that's the traditional patient exam, and along with it, candidates take the CSCE OSCE. So the ADEX patient examination is the patient treatment clinical exam and the OSCE. The next exam that we offer is the ADEX dental hygiene mannequin exam. And the complete mannequin exam encompasses the dental hygiene CSCE OSCE and the mannequin clinical exam. So both of these exams have the two parts that go together to make the complete exam. The third consideration that, that we've offered is the ADEX dental hygiene, the CSCE OSCE, that some states have utilized for provisional or full licensure. Provisional temporary licenses, some states have been creative and have, in issuing those types of licenses, have attached with it a successful completion of the CSCE OSCE exam. So those are the three examinations that we at CDCA are currently offering on behalf of ADEX.
And Pat, don't you feel though that this year really, as a state board member, and I'm speaking to all of them on this call, that there has never been a time that the word clinical has been more scrutinized than this year? What does clinical mean?
Absolutely. There's been more times we've enjoyed sitting in on a lot of board meetings, and how much time has been spent. What does clinical mean? Does it really mean the patient? Is it a simulated clinical or whatever? And it all comes, it has a role in all of these examinations, for sure.
It definitely
And
has.
a very discussed word.
Yeah. If there was a word of the year, it might be clinical and then OSCE right behind it.
Right.
So I would like to move on. Dr. Blumenthal, we have some just the CDCA administered ADEX exam by the numbers. If you don't mind, can you just share with the group what these numbers were? It's basically covering how many exams we did, acceptance, and so on and so forth.
Right. Dr. Armstrong pretty much reviewed the first part of this. And we should note that we update our map regularly so that you can see what the current state of affairs is. The one thing that we didn't bring up is that there are 4 states that have accepted to use the CSCE OSCE for licensure alone. They're Oregon, Texas, Missouri, and Kansas. Since June, the CDCA has delivered 3,042 dental hygiene exams. Of those, 2,680 were the mannequin-based exams with the CSE OSCE, and 362 were the PTCE with the CSCE OSCE. We delivered those exams at 104 sites and served 250 schools in so doing.
Yeah, and I do. My friend Kathy Harris has submitted a question about, can the mannequin or patient-based exams be taken only without the OSCE? Pat, do you want to cover that real quick?
They can be taken only without the OSCE, depending on what the state board decides. But the thing to always keep in mind is that if a candidate wants to have the portability of the ADEX examination, they must complete both parts. So at first look, it may seem like, oh, if they only take one part, like, we're doing the candidates a favor. But in the long run, I think we find that most candidates end up taking the entire exam. But the state boards can decide what it is that they want to have as their licensure requirement. But just make that decision knowing the portability piece. The candidates need to take both.
And when we do have states that are only requiring a single part. But when I have the opportunity of meeting with the students, I do encourage them to consider taking both parts for the portability purpose of it. So they're hearing it, and not only are you hearing it from us this evening, but the students are hearing it when we meet with them to help them prepare for the exams. So
I think a lot of the schools also encourage their students.
Yep.
They bring it to their attention, and they encourage them to take both parts.
So on the CSCE OSCE, we'd like to spend just a few minutes and bring in actually a special guest this afternoon or this evening. Miss Christina Baker is going to join us. She is an educator from UMKC. She's the assistant clinical professor for the UMKC Dental Hygiene Department. Hi, Christina.
Hello there.
So Christina recently took the OSCE because her students will soon also be taking the OSCE. So in order to help her prepare, we offered to allow her to go take it. So Pat, I'm going to turn this over to you for you and Christina to have a quick discussion for our state boards to hear a little bit more about her experience in the OSCE.
Okay, thank you, Christina. We know how much we appreciate your being here. I think you're going to be one of the few people in the audience that really knows what this exam is. You've seen it, you've taken it, and you know it. And as an educator, you also know how candidates are prepared. So thank you. We do appreciate it. I'm going to ask you some of the questions that I always get from state board members regarding, and also sometimes educators regarding the OSCE. So first of all, and everybody to know, we're just asking you to candidly share your experience in taking this exam and some of the opinions that you had after you finished it. So please just feel free to be candid and give us your feedback. I'm not going to ask you if you passed, so don't worry, that's not the first question.
I did, I promise.
But just very quickly, this is just kind of an offshoot and not really, not a big real question, but did you find that you needed to have a lot of preparation to take this examination?
So I Obviously, for me as an educator and someone who's practiced, I did not think I needed to prepare as much for it as a student would. However, I do think that a student who studies and adequately prepares for clinical sessions would be adequately prepared for an OSCE exam.
Okay. But sometimes we say to, for state boards that use it for relicensure or for entry back into the profession, I know I say that I would much rather, if somebody told me I had to take national boards or somebody told me I had to take the OSCE, I think my preparation for the OSCE could be much less because it's so clinically oriented. I was wondering if you felt that same way.
For sure.
Okay. The next question I have, and I'm not sure what your opinions were of the OSCE going into the exam, but after taking the exam, do you see the additional benefit of including the OSCE along with the hand skills assessment for licensure for dental hygiene?
Absolutely, 100%. I've given a lot of thought to OSCE. There's been, there's a lot of research out there concerning OSCE. A clinical boards exam, a live patient clinical boards exam is great for one patient experience. However, with an OSCE, I did feel like it kind of encompassed all sorts of patients you might see in practice. And so absolutely, in addition to a live patient-based exam with OSCE, I would 100% recommend it for sure.
Okay, thanks. Often when we speak to boards, we speak to educators and really students too. I think very often we get the question, why does ADEX have to have a second exam? The other agencies don't have it, or it's just a duplication of national boards. So why do you have it? Why don't we just take national boards? So again, from your experience as an educator who I think is familiar with national boards and now familiar with the OSCE, how would you answer that question? Is the OSCE the same as national boards?
Okay, so they are definitely not the same at all. National boards covers all sorts of topics like nutrition, public health, ethics, morphology. So items that you would have learned in your classroom, essentially. OSCE is significantly different. That basically all questions that I was asked are things that I would have learned in my clinical experience working on a patient. So they are absolutely not the same. So I thought there was definitely value in taking both an OSCE and National Dental Hygiene Boards exam.
Okay, and specifically, do you think that the OSCE was a good test of knowledge and application of performing an intra and extra oral exam and the findings that may come from that oral exam? Do you feel that the OSCE did that?
I would say so. There were some questions relating to anatomy. So identify the gland that the arrow is pointing to, or the perio questions. Those were all adequate questions. They had great images that went with them, asking about clinical attachment loss. There were x-rays that were provided in addition to a case study. I felt like all questions relating to intraoral exam, those were all very adequate questions. They were all images that were provided supported the questions that were asked. And I felt like anyone who would take this exam would know exactly what's being asked relating to an intraoral exam.
And do you think it was a good simulation of a patient exam and performing on a patient exam?
Yes, for sure. Especially relating to, the oral cancer screening. That was another one. There were a lot of questions relating to pathology, because as dental hygienists, that's something that we are doing is an oral cancer screening. So I felt like it was it was a great simulation. The fact that it's a written exam, of course, but it was a great simulation on intraoral exam for sure.
I think that feedback might help a lot of board members that are on this call tonight. There's a lot of boards that have that requirement and when their regulations about an intra and extra oral exam. And I just think that feedback from you could be really very helpful to folks. Well, those were my 3 questions. Shana only gave me time to do 3 questions, because we certainly do. We do know what a busy time of day. We know you have a young family, and we know this is a very busy time of day for you. So from my point, thank you very much. I appreciate that feedback. Do you have any other information that you want to share with us before I turn it back to Shayna?
Oh, I have so much I could share, but I won't take all your time. But thank you for having me. I really appreciate it. I do feel pretty passionately about OSCE, so I felt like this was a great exam to take. I felt very lucky to have the opportunity to take the exam, and I feel more prepared to prepare my students for it as well.
Well, thank you for taking that opportunity. We throw that out to a lot of people, but you have to be brave, I think, to go ahead and step forward to doing it. So thank you for taking the opportunity, and an extra thank you for sharing this feedback with us. It's so appreciated.
Of course. Thank you.
Christina, it's good to see you. Thanks for joining us tonight.
Yeah, thank you.
Thanks, Christina.
Well, that was fun. She has the best smile. So I want to continue on now to our OSCE and just give Pat, if you provide the boards the information, our clinical information about that OSCE. Stephanie's going to put that slide up for us, and we can quickly cover this as the details and content of that exam.
Okay, I think many board members that are on this call tonight are certainly familiar with the OSCE. I think we have some new board members, and maybe we have board members that haven't heard the CDCA presentations about the OSCE. But we mentioned before, it's part of the exam. It's been part of the exam since 1971. It's been constant. It's been constantly and continuously administered. All of the candidates to get that ADEX status, we already said they need to take that exam. The exam is 100 questions, and there's always 15 questions that are being piloted. We usually can pilot about 30 questions a year, and then they're psychometrically evaluated. And if they pass muster and with the difficulty and the fidelity and all of that, then they are included into subsequent years for the examination. This is the breakdown of the content. Where this content comes from is from the occupational analysis. Every 7 years, ADEX has conducts a national occupational analysis, and it asks what are the tasks that are most frequently. They ask the tasks that are performed by entry-level hygienists or hygienists out there practicing. And what they're doing is they're asking in this occupational analysis, they ask how frequently are those procedures done, and how critical are those procedures to the health of the patient. So they take that criticality score and that frequency score and all of the tasks that have been surveyed, they then take and say which are the most frequent and which are the most critical. And that's what you have in front of you here. This is what's been determined by the occupational analysis to be tasks that are critical, that are frequently done, and therefore should be evaluated on a licensure examination. What you don't see here is calculus detection, calculus removal, or probing. That is done clinically. Once all
that would be the next slide.
Okay, but we're not there yet. We got to stick with this one. So these tasks, once all of the information from the occupational analysis is looked at, it's then decided, and this is the ADEX committee working with the psychometrician, what's the best way to evaluate it? Is it best to evaluate it clinically, or is it best to evaluate it as an OSCE? And so once those decisions are made, then they are, let's just say here, we've added these into the OSCE, and you'll see they all have different weights. That is also tied into the occupational analysis. The weight, the heavier the weight that is given is the combined score of the criticality and the frequency. So you can see here intra and extra oral exam and charting. In the occupational analysis, it came back as something that was very critical and that it was done very frequently. And so therefore, more of this exam is dedicated to those skills. So that's the CSCE. It is annually evaluated psychometrically. New questions, there's a committee that meets annually, and new questions are always being added. And there's our exciting new questions now and new formats. that is making this examination be much more interactive with students. It is or candidates, and it's increasing the fidelity of the examination. This is an examination that we are extremely proud of. It's, as I say, it's been around, it's constantly been improved, and it really nails all of the procedures that are important for evaluating the profession of dental hygiene. It takes it beyond just hand skills, and it brings it into the profession. So this is an examination that I feel passionate about, and I think it's really one of the huge strengths of the ADEX examination. And I could go on forever about this, so I'm going to stop here.
Okay, so can you take us into the next slide then and quickly cover just the ADEX patient-based criteria, content, and scoring?
Okay, this the clinical exam was administered in 2020, and as Stuart said, 362 candidates did take this examination in 2020. The only change to the 2020 exam, you may remember, or who can remember last January, it seems like it was 5 years ago, but the only change was a change in the radiographs in determining what are the characteristics for diagnostic radiographs for the dental hygiene exam. It has been that for the dental hygiene exam, the apices of all of the roots of all of the teeth in the case selection had to be visible on at least one film, one radiographic film. And the 2020 exam changed that criteria, and that they made an exception that the distal root of the apices of the distal root of the third molar did not have to be visible in one of the screens. It's a film that was often very hard to get. There were unnecessary retakes in trying to get it. And if there's no clinical indications to not treat this patient, because of that tooth, it was decided that that would be a change for the 2020 exam, much to the relief of, I think, a lot of our examiners, especially our clinic floor examiners, and certainly the relief for the candidates. So this exam, one thing that the time, we did have some changes in time when where the exam was extended because of a COVID precaution, but we followed all the CDC guidelines. There were also school policies and precautions that we had to follow, all of the PPE, the social distancing, whatever. It made for smaller groups, but this exam was still able to be successfully administered in 2020. Granted, to a much smaller group, and I think we saw most of our administration of this early on. A lot of it was in June when candidates were signed up for it because their exam had been rescheduled from March to April to May, and then in June, and they just decided they had a patient, they wanted to take it. So that's where the majority of the patient exams were administered. But there are some states that don't accept a mannequin exam, so we certainly gave exams in those states. But the overwhelming majority, as you saw by the numbers, did take the mannequin exam, but this is still our solid. There were no changes to the criteria, that one criteria change, but the scoring and the content of the exam remained the same for 2020. So that was the patient exam. So the OSCE has been around, I said, since the early 70s. This patient exam has been around since the late 60s, I think was when dental hygiene exam first started back in the days of NERB. But we have the new kid on the block. The mannequin exam has arrived. It's new to the scene. And Shane is going to walk you through the evolution of how the mannequin exam came to be.
Well, at least half of it I'm going to walk them through. But, the one thing I want to emphasize is the CDCA is still administering patient-based exams, both for dental and for hygiene. We also have the mannequin-based exams, at which we did multiple areas of dental hygiene exams across the country in the mannequin-based format. So to begin, the research for a mannequin-based product was really based around a calibration necessity. We felt like we needed to how we going to, we're constantly looking at ourselves, evaluating how we better improve the process. And one of those things is how do we better improve calibration? So we came across a typodont from Accidental that had kind of what we were looking for. And Pat can speak to this a lot better than I can, as far as how long we have looked for something. And of course, Hygiene has looked for and hoped for a exam, a typodont, something that would simulate calculus. Educators who are on the call would love to have that for their clinics, but they were mixing up magic stuff in bowls and putting it on teeth and all kinds of things to try to create this calculus that they could reproduce for their students to learn upon. So about November 2019 to January of 2020, this is when we were evaluating this typodont for calibration. Then in March 16th to be exact, we had to suspend exams. And really what was happening around us at the time was schools were already suspending exams. So we were, and I was thinking about this today, Pat, as I looked back on it. The conversations we had in March were, let's move our exam to July. We'll just move it to July, right? And then we moved it to July. We moved that patient-based exam to July. Then that patient-based exam went further out into August. Well, we'll move it to August, September. Then they started switching into mannequin-based exams because the state boards were accepting them at an increased pace. So we were able to, the one thing I'm super proud of our organization was that we were able to transition from already scheduled patient-based exams to mannequin exams within the same series. That was impressive, and part of this calendar is really this timeline we're giving you spells that out. So Pat, I told you all this is kind of like, do you remember where you were that day? I remember where I was on March 16th. I was in Atlanta, finishing up a dental board meeting and heading back home. So I knew where I was the day that we had to suspend all of this and move ahead. So I'm gonna let you take it over from April, because that's really where you and Dr. Blumenthal kicked it into gear and started really developing what we know now as the mannequin-based exam.
Right. Thanks. Yeah. It became evident right around the end of March, the very beginning of April, that there needed to be something. The candidates needed, our students needed to have some way to be licensed. Boards were looking for ways, they were looking for help in being able to evaluate and what could be done. Clinics were closed, nobody was seeing patients, and the mannequin exam came into being. It was just, it was like spontaneous combustion. Boom, here it is. We're going to do the mannequin exam. And so our very first meeting, and this was, I remember this day well, was April 7th, was the date that we met with Accidental to discuss the possibilities of having a mannequin exam. There was no need to plan an exam if there was going to be no product to give the exam on. So we met with Accidental on April 7th. We said what we wanted to do. We had, as Shana mentioned, we had had a number of their mannequins. We had had their calculus detection model, and we had also had their removal model, which circulated amongst lots of people at the January annual meeting. So we met with them, we told them what we wanted to do and to see if it was possible. But we knew that we couldn't have ADEX build an exam unless we really knew that the product was good. The factory was closed. We asked, how many mannequins could you give us? We need to do a product feasibility test. And we got 30 of them. Those 30 were distributed to subject matter experts. We only in COVID could we have done this as quickly as we did, that I could call 30 people on the telephone and they all answered, number one. And when I said, if we sent you, if you're interested in participating and we sent you a typodont that will probably get there by Monday, can you go someplace and evaluate it and get it back in the mail to us by Thursday? And all 30 said yes. Okay, only in COVID could that happen. So that's what would happen. We developed a software system to gather all of the data. And what we were looking for was this mannequin, was this product a good simulation of a patient? That's what we wanted to know. So that went on in April. It was completed. We had all of the mannequins back in the office for evaluation. Our evaluation was on May 7th. So a month to the day, all of that was completed. So in April 2020, notifications from state boards, we started to receive these notifications that they were accepting non-patient dental hygiene exams or mannequin exams. And we didn't even have the exam yet, but we found out that we were accepted. The exam was accepted by some boards. So we knew we had a deadline and we had to get going. So the data we sent to our psychometrician was all reviewed in May, and the psychometric report was on the product. Remember, we still don't have an exam. It's the product that we were reviewing. And that was, we were able, so that all happened in May and presented to the ADEX Dental Hygiene Committee the middle of May on May 15th. That was the birth of the baby, now known as the MTCE mannequin exam. It all happened on May 15th. And then it was going back and meeting with Acaddental to get the changes that we knew we had to have. There are changes, there were the needs to, and there would be the nice tos. And we, our first examination was scheduled for July 10th. It was we had 2 that weekend in Miami and 1 in Mississippi. And we examined close to 300 candidates that one weekend, right out of the chute. So we were able to make some improvements to the mannequin before we used it in 2020, but we also had our priority list of the types of enhancements that we wanted to continue to improve.
So Pat, I do want to clarify, we were able to customize the typodont to meet the needs of ADEX and the CDCA.
We were able to make, we couldn't make all of the changes that we wanted to make, but we were able to add some more deposits. We were able to change locations of deposits, and we were able to add more surfaces and add more deposits. We were able to do that.
So, and I'm gonna ask one more question, Pat. Within this timeline, which would actually be previously to this timeline, can you talk about the, if there were any other typodonts considered? I know we'd considered them in the past. None of them really were exactly what we were looking for, but can you elaborate a little bit on how we ended up with the Acaddental typodont?
Right. We had been looking, I think everybody knew that non-patient based exams were going to happen. It's just we didn't know when. And as you mentioned, Shana, calibration was really a focus that we had. So we've been looking for typodonts that we could use for calibration and in the back of our minds would simulate good calculus for an examination setting. I want to say that Ellis Hall, Dr. Hall, our Director of Examinations, and I have been probably looking at typodonts for 4 or 5 years. We've had many, many samples that we've tried. And of all of the typodonts that we did look at and we did evaluate, we had already determined that we thought Acaddental was the best. It had the best calculus. We thought that it really was the best simulation. It had the best tissue. It wasn't transparent. So there were a lot of things that led us to knowing that as we went forward, we wanted to work with Acaddental. And that was all pre-2020, I would say, that we had already reached that conclusion. Does that answer your question?
It does. It does. Thank you. And I do want to note that we've got about 15 minutes left or so within our hour. So the next few slides, I know you all are joining to hear about the mannequin exam, so we want to get to that. I also still want to encourage you to ask your questions in the Q&A. You can go ahead and type those in. We'll continue to answer those questions as they come up. So the next thing, Pat, to cover is the criteria, content, and scoring within the mannequin exam.
Okay, the goal, we're running late because I'm talking a lot, so I'm going to talk faster and less. So the goal of the mannequin exam was to have it mirror the patient exam as much as possible. Obviously, anything that had to do with the selection of the patient, the eligibility of a patient, and the case selection had to be eliminated. And those points were then reproportioned and included into the categories that were going to be evaluated. And that was calculus detection, calculus removal, periodontal probing. So these are the points. This was our scoring rubric for 2020. It will remain the scoring rubric for 2021, but a difference will be, and we'll talk about that in a bit when we get to it, is that in 2021, we will evaluate tissue management. That was something that was not included, and probably rightly so, it was not included in 2020, but we are going to introduce it back. And it's going to be not as part of this rubric, but introduced as penalty points, similar to the perio exam. So that's the content criteria and scoring for this mannequin exam.
Thank you, Pat.
You're welcome.
Dr. Blumenthal, Dr. Armstrong, is there anything you would like to add at this point? Are we doing okay?
We're doing great.
Yep, doing fine.
Okay, we'll keep going. So the next thing, and we don't really have to spend much time here either, but I do, we had hurdles as an organization to get over, just like you all as state boards had hurdles to get over, as you heard from the schools themselves directly letting you know their personal situations. So, schools were closed for extended periods of time. And as an organization trying to plan exams, you now are dealing with social distancing, how many people can be in the room, how many can't be in the room. We can only accept so many examiners. It became a lot. And of course, we all know and heard on the news when both the CDC and the WHO recommended that you shouldn't even visit your dentist. I had more phone calls after that made national news of, now what are we going to do? Because we had only started moving exams a little, still considering a patient-based exam. So it truly, and last but not least, of course, was the PPE. It just became impossible for schools to find. So there was a lot of hurdles to get over as the organization that we administering the exam and the schools working together to try to make this happen. Dr. Armstrong, you administered several of these exams at the schools. You did this, I believe you've had a patient-based exam and a mannequin-based exam. Tell me the difference between the two as you relate to patient and mannequin during this COVID time.
I think the biggest difference you have between the two, aside from the much more relaxed demeanor of the candidates, because that have the mannequin basis, because opposed to the patient base, they're not worrying about their patients not showing up or anything like that. There's a couple things that do affect the mannequin based, and I think the two most important ones would be case selection criteria. That is removed for the mannequin exam. So there really does weight more towards their clinical skills, which is good. Also, for the patient-based exams, and some of the educators ask, well, why is your pass rate a little bit higher, which we'll get into here momentarily, but why is the pass rate a little bit higher? And I think one of the primary reasons for that is that in a patient-based exam, the candidate can pick a much more difficult case or have a case where the calculus doesn't even qualify. So they may fail for those reasons. Whereas with the mannequin exam, you have very standardized number of surfaces, quality of the calculus, the extent of the calculus. So I think it really levels the playing field for the candidates. And I think I think the educators do agree and the boards agree that's a good thing. We want everybody on an even playing field.
Sure, absolutely. Well, quickly, and you, Dr. Armstrong, you hit on some of the things on this next slide. Pat, can you quickly kind of go over, the pathway forward, what we did realize in offering a mannequin-based exam, the opportunities that it did create to keep moving forward?
Right. I think what this did, it really made us look at what we're doing. What have we been doing? Why have we been doing it? And it made us question what we do, why we do it. And that's all been good. We've questioned on how we grade. So we looked carefully and have found and had to find better ways of doing things. And basically, I think Mark just covered it. The case selection and the clinical requirements were all fulfilled. A big worry of candidates. That I think is, if you had to pick, from my point of view, if you had to pick the biggest stressor for a candidate, I think that's it. Case selection, finding the right patient whose blood pressure is right and has the right number of pockets and all of that. I think that's the hardest. And so eligibility and case selection, we didn't have to worry about. They don't just basically have to worry about patients. They just have to worry about their own skills and their own exam. Mark said everybody's taking it under the same conditions, under the an even playing field. The infection control was able to be, using the same word, but it was able to be monitored and controlled better with a non-patient based exam. Very important this year was the reduced size of an examination team. Schools didn't want a lot of extra people coming into their buildings. We were able to very often use local people because we didn't need as many. We have basically exams are only 2 or 3 examiners going into a school to administer a mannequin exam. The candidates all are given 2 hours. There's not that time then for grading. So we could deliver the exam more efficiently. We could do 3 groups a day. So even though we were social distancing, we could have 3 groups rather than the 2. I can't say more could be seen in a day, but we had more groups. And a big thing in talking to 2 schools today, that the advanced PPE was not required. It's still an issue for schools. It's a cost issue and it's an availability issue that they are still facing. And the favorite of the candidates was for the mannequin exam, they could use a Cavitron. So these were things about the mannequin exam this year that we found.
Dr. Blumenthal, I would like for you to quickly cover, and we've got some great questions in our chat and our Q&A. Some of these questions are getting ready to be covered, so we'll get to those, and then any of those that aren't covered, I'll circle back and get those answered. Dr. Blumenthal, can you give us a quick kind of overview of what we're calling the first generation MTCE included?
So this first generation, the typodont we're using currently in the field, we were faced with a number of manufacturing issues and constraints, given the fact that we started evaluating the product in April and we had it to market and in the field at exams in July. We took 2 existing products that Accidental had, which was a combination of non-removable calculus arch and a removable calculus arch, and combined them into one typodont. Both of those were made to our specs. Accidental was shut down during this period as well. So they were not able, had to get up and retool, but they weren't able to retool all their manufacturing processes. So we had some limitations based upon what they were capable of executing in the time frame that we needed and based on their current machinery. The things where the calculus was black, there wasn't the calculus variation that we ideally wanted. The root surface was too soft, and we found that these teeth were getting loose with the candidates playing with them at the extent that they did to remove the calculus. They were very judicious in their removal. So these are the things that we found with this product and the things that have informed our enhancements moving forward, which I think Pat's going to talk about. Is that right, Pat?
Yeah. Well, I wish I could see a show of hands of those that are with us tonight. You know, we have 33 states represented this evening in this call, which is phenomenal, and we appreciate their time. But I wish I could say by a show of hands, how many of you remember these Cavitrons or had personally used them?
Not the one on the left.
It was hard to find these photos, people. It's hard to find these photos. So Pat, can you tell us about the second generation? We do have a lot of questions in our Q&A specifically about what you're getting ready to cover in what's coming for 2021.
Sure. Okay, let me cover it. And if there's any additional questions, then just send them my way.
Yeah.
So the 2021, which will show the second generation, like any good product, when it comes on the market because it fills a need, and this exam filled a need, and as did Post-its and all other kinds of great inventions, and they just kept getting better. And I think this exam is just going to keep getting better too. So this is our goal. We want to go from those last slides that we just saw for Cavitrons. We want to be looking something like this real soon. I have been assured, but I was assured before too, but the calculus is not going to be black, and I've seen evidence of it. I want to say one of the things that I find most encouraging is we did want to make more changes last year than we could, and I think Stuart explained why. But the process, I think what's been impressive with Academic is they know what we wanted, and they have continued over the summer and through the fall in developing and doing the product development that we've asked for. So we approved samples for color of calculus back in August. It is not going to be black. The black ended up not being so much of an issue because it was about removal, and candidates who present a patient know where the calculus is already anyway, so what's the difference? So it ended up being that much of an issue, but I think it's an optic thing. The calculus has been, we've picked out the shade, the calculus is not going to be black. Next week, we will get a sample for a harder surface. Looking forward to that. And on that harder surface, we've also worked with enhancing the texture of the calculus. We don't want it to be smooth, and we don't want all of the deposits to feel the same. So there'll be different shapes, there'll be different textures and different sizes. I have already seen the finished product for the calculus detection. We have added surfaces, and it's good. There is variation. And so very pleased with the 2021 calculus detection product already. The hardness of the surface, we are being led to believe, and Academic does feel that that's going to solve two issues. It's going to solve the loosening of the teeth because they're going to be able to latch on and connect better. So this is what the improvements for 2021 are going to be. These are the new improved models. It won't be black. We're going to have that harder surface, which I think is going to make a huge difference. The texture and the location. There's going to be more calculus, and there's going to be better quality calculus throughout every arch or every quadrant.
Thanks, Pat. It's exciting for sure. Stephanie messaged me that we actually had 10 people raise their hands through Zoom that they had used the older, they were familiar with the older Cavitrons. So quickly, we'll move ahead. We do have some good questions as well that I want to get to, but Dr. Armstrong, can you please just kind of cover the exam results here that we saw for 2020? And I would like to quickly focus or just note, this is from June to October. So we took the sample which we've been testing for the 2020 calendar year.
Thanks, Shana. Yes, over the past 4 months, we've administered 362 patient-based exams, which have had a pass rate of just over 94%. We've administered over 2,600 mannequin-based dental hygiene exams with a pass rate of 98% plus. We've also administered 2,200 OSCE dental hygiene exams with a pass rate of 95%, almost 96%. And like I said, some of the question was, okay, why is there that difference between patient-based and mannequin-based? And I highlighted probably the two most important parts of that were case selection and more standardized calculus with the mannequin-based as opposed to the patient-based.
Thank you, Dr. Armstrong. And then quickly to wrap this up, and then I want to get to these questions for our panel, was the feedback that we had received from candidates. We do survey candidates after their exams to find out about their experience with their CDCA examination process. Some of them are kind enough to add additional comments about how their experience was. So, you know, and as Pat mentioned, the University of Mississippi was one of the very first exams out of the gate that had the experience of having the mannequin-based exam. And I know that our exam teams can tell you on a wholesale basis, both dental and hygiene, a mannequin-based exam relieved the anxiety of patients that wouldn't show up, that may not qualify, all of the things, not that they had to work on a patient, they aren't concerned about working on the patients, it's all the things that lead up to the fact of being able to work on that patient that day for the examination. So we were proud to have good feedback, you know, and that this feedback wouldn't be coming to us if you as board members didn't approve this pathway for this class of 2020. I have met with many across the country, and they're extremely appreciative almost more appreciative this year of the opportunity that's been provided to them, both in having an exam available and being able to do it on a mannequin. So, and that really does come down to the state boards making the decisions that they made. And not that a patient-based exam is any different. We also had patient-based feedback that was phenomenal, right? Candidates have been so appreciative to the exam teams. Thank you for being here. Thank you for, traveling to our sites, things like that. So both mannequin and patient-based exams candidates were very appreciative over this last few months. So, and quickly, I wanted to cover that we are not the only ones talking about this mannequin-based exam. You can find these candidates on YouTube, on Facebook, in publications that are written by news reports, wherever they may be taking their exams. They're everywhere. So it is definitely a conversation worth having, definitely a conversation. So if you haven't YouTubed it, feel free to YouTube MTCE. You will find these candidates and their own experiences being told from their own perspectives. So I'm going to get to some questions now really quickly. One that I find intriguing and look forward to the answer. Dr. Blumenthal, I'm going to start with you. How is the exam integrity protected to prevent cheating?
Which exam are we talking about?
Well, I mean,
the exam integrity, I would say for the OSCE is that there are different forms of there are a couple different forms of the exam that are being given, as well as the fact that questions are being updated annually. So there is some that answers some of that. The other thing we're introducing are alternative item types, which are not multiple choice exams, which are not multiple choice questions. They're fill in the blanks. There's some matching, extended match, and using hotspots. So that's something that one cannot be translated. It's something that increases the fidelity of the exam.
And Pat, I'm going to ask you the same thing about the mannequin, because we spent a lot of time making sure this wasn't repeatable every single time, that each candidate was delivered a different exam than the neighbor beside them.
Right. We had a total of 10 versions of the clinical examination, 5 versions per quadrant. We evaluated for this particular year, we evaluated calculus removal on the mandible and calculus detection on the maxilla. We had 5 different versions of assignments, from calculus detection to probing and calculus removal. So no 2 candidates got the same. So there were 10 versions, and they were spread out. Yes, did 2 get the same exam? Yes, but they were just randomly assigned the quadrants, and that seemed to have worked. And it's a process that we are planning to continue for 2021.
And I know we covered this, but I feel like it's worth repeating at least one more time. This question was sent in asking, will both hard and soft tissue trauma be evaluated in 2021?
Yes.
On the mannequin exam?
Yes, it will be incorporated.
Yeah, that's.
And John Williams asked this question, and I like it. I'm going to let Stuart go into a little more detail here. Are the new questions COVID smart? I'm assuming we're talking about the OSCE. Of course, COVID wasn't in reality until much later after OSCE development. But can you talk about how we can, if things like this come up, we do have that capability?
We do have that capability. However, before a question can be incorporated as a scored question in the exam, it has to be validated psychometrically. So that question needs to be piloted before it can be a scored portion of the exam. I can say that we will most likely have COVID relevant questions to pilot in the coming year, but it's certainly not something that will be incorporated into an exam within the next year.
Dr. Armstrong, I'm going to ask the question that we also had on the dental webinar that we hosted is, how do we know and can trust a mannequin exam for these hand skills components? Because it's not a patient, there's no tongue, there's no saliva. State boards are making these decisions based on the information they have. What can we tell them about the mannequin-based dental hygiene exam?
It's a perfectly valid question. I mean, that comes up all the time. How do you handle a patient who can't keep their tongue under control? How do you make sure you get adequate anesthesia? And those are things that are important to test. But if you look over the years and years of examining and the statistical results, the number of people who have failed because of inadequate anesthesia or patient management is almost nothing. So while you have to be able to manage a patient, the criticality of that when you look at the occupational analysis just doesn't wash out exam wise. And it ends up becoming an issue for the state boards. Does the state board in Ohio or Indiana decide it is really important that we know they can manage a patient well and test on that?
Thank you, Dr. Armstrong. Dr. Blumenthal, this question I'm going to send to you, which we aren't focusing on dental tonight, but there is one question because it's perio related. Will dentists be able to take the perio exam on a mannequin at a hygiene school? Before you answer that, the one thing I am going to say is that our hygiene schools are in the same situation of not allowing outside people in. They are very restricted in numbers. Most clinics are much smaller than at a dental school, so they really don't have the same amount of room. But with that being said, Dr. Blumenthal, can you elaborate further on how that could be possible?
It could be possible. It's a logistical issue that our logistics team would have to address. The grading platforms are two separate grading platforms between the perio exam and the hygiene exam, but it is certainly something that could be done. But again, it's dependent upon whether or not a school would let outside candidates come in, and it's a logistical problem or question as far as product and scheduling. But there's no reason why that could not happen.
Yeah, perfect. Well, and we had a lot of state boards asking for, can we see the teeth? Can we see the calculus? What I want everyone to know is that we had to dedicate, just like in dental, every bit of product we had to the candidates. There was, as you saw, over 3,000 students who needed to take an exam, and Acaddental could only make them so fast. So we are working to continue to give you, we want to provide that to you all, but at the same time, also providing exams and having a product for the candidates this year. Pat, do you want to elaborate more on that, or Stuart?
The only other thing to note on that, and since we talked about perio, our goal was to get this product to the hygienists for the hygiene community. The product itself we're utilizing the same product for perio. It's evaluated a little bit differently, but it is the same product. And we did not deliver any perio mannequin exams until we served the hygiene community.
Shana, also to that point, all state dental board members should know that if you are on an active state dental board member, you are always invited into an exam as long as the school administrators allow that. As far as CDCA is concerned, we encourage anybody any active board member to come to an exam, see how it's administered, check out what we actually do. It is your exam. We're administering the licensing exam for you.
And I'd add to that, for those that are CDCA examiners, please come and sign up and to do a dental hygiene exam. I think that's really the best. I think we've had a lot of board members scheduled at either on-site or come to the grading sessions. We've been grading these exams, not on-site mostly, we've been grading them back at the central office. We've had a lot of board members come and participate in that. And that's been a great learning experience, I think, for all board members that have attended it. They thought that's been a really very worthwhile thing to do. So I encourage everybody out there to please sign up, come and do a hygiene exam. Would love to have you.
Pat, I'm going to ask this question of you. For the 2020, they're asking about, was the gingival easily retractable with instrumentation, and will that change for 2021?
Was it easily retractable? I would say that we got good feedback mostly. We got good feedback on the gingiva, that it was realistic. I think the probing people felt was the most realistic. we are not making changes to the, we'll call that soft tissue, to the gingiva for 2021. Our emphasis for 2021 is in improving the hard tissue. And that's where our changes are going to be. But we've gotten good feedback. You know, there's been some who don't think it's perfect, but they do think that it is a simulation. We always say, don't let perfect get in the way of good.
We're waiting for that.
Yeah, and we do think that the soft tissue could stand behind the changes that needed to be made in hard tissue first.
And I do know we had this in a slide, but we'll quickly cover, just repeat it one more time. The Cavitron, if a school allowed for Cavitron use, Cavitrons could be used on the mannequin-based either dental hygiene exam and or perio. Correct? Everybody with me on that? Yep. Okay.
As well as patient-based exams.
Yes, that's correct. That's right.
Right.
So they are allowed. What was the, Stuart? Was that after September 1st? We allowed
After September 1st.
Yep.
Yeah.
So so that is permissible. Thank you for asking that question. And you know, we worked hard. I can tell some of the people asking questions have heard our presentation on the Competent. So they're asking about that tooth hardness. You know, we talk a lot about the tooth hardness in the Competent, and they're asking if that is going to be replicated possibly in the dental hygiene exam for the tooth hardness. Any of you panelists want to take that question?
That has been discussed. I think that is what they are attempting to do. We have not seen that yet. So it's a waiting. That's where we are in that. It's in process.
Right.
I don't know if they're going to be able to step it up all the way to that, given the numbers that we need to do, because with the Competent, we're limiting it to only certain teeth that we're utilizing that process on. For the hygiene mannequin, it would have to be every surface of every tooth. So again, there's some limitations on what we're going to be able to do.
And Pat, you said you are receiving the new harder tooth. At least you're going to be getting a sample of that soon.
Right. Hopefully within 2 weeks, and I'm hopeful that it would be next week that we're going to see our first version of the harder tooth surface.
Well, I want to say we are almost right. We're just a little bit over an hour. We've answered all of our questions submitted to us. If you do have any questions, please feel free to type them in the Q&A. We're happy to answer them. But that is the formal end of our presentation. So Pat, Dr. Blumenthal, Dr. Armstrong, we thank you very much for presenting tonight, being here. I also want to thank Christine for being here as well, and her part in talking to us about the CSCE. So thank you all. Thank you, board members, for your time. We greatly appreciate it.
Absolutely. Yep. Thank you.
And we're getting through the chat, which I know you guys can't see, we're getting a lot of thank yous and excellent job. So kudos to you all from our presenters.
I just want to add just one thing. I don't think we could be here today without it being such a group effort from agencies, schools, boards, I mean, everybody, candidates across the board. It was truly what was done, accomplished in a short period of time is because of everybody's contributions.
Yes, absolutely. Completely agreed. Pat, the Pat and Shana show has continued. We've added Dr. Armstrong and Dr. Blumenthal. So again, thank you all. We joke about the Pat and Shana show, but we do have webinars on our website, cdcaexams.org, that talk about the MTCE. So please feel free, if you want more detail, more process about how the